Ethical Dilemma presentation by Ayan and Kiki. Case Study 1. A dental hygienist saw a patient for a routine scaling in the office of a general dentist. She found a periodontal problem that had not been noted previously in the patient's chart. She explained to the patient the existence of an abnormality and that she would talk about it with the dentist. She communicated to the dentist in private that the patient exhibits what she feels could be a moderately advanced stage of periodontal disease. The probing revealed numerous 6-millimeter pockets and the tissue was inflamed and enlarged. The dentist responded, "Don't worry, it's been that way for a long time. I think we can maintain her with routine cleaning periodically." The dentist tells this to the patient, then moves on to another patient. The hygienist then tells the patient that she is not comfortable doing only a scaling, so maybe the patient should reschedule at another time with the other hygienist in the office. When the patient heard this, she asked what the hygienist would do if she were in her position. The hygienist replied, "I would see a periodontist." Ethical dilemma: the patient's condition. The dental hygienist observed that the patient has moderately advanced periodontal disease, with probing depths measuring 6 millimeters, inflamed and enlarged tissue. The dentist responds. The dentist dismisses these findings, suggesting that the condition had been present for a while and could be maintained through routine cleaning. Ethical consideration. The dental hygienist is now faced with a choice. Either follow the dentist's orders or advocate for the patient's health by recommending further specialized treatment, which raises questions of professional responsibility and patient advocacy. Step 1. Identify the problem. The ethical problem within this case study is not treating the patient based on evidence-based research. The patient has findings that indicate the need for specialized treatment. The ethical dilemma that the dental hygienist is conflicted with would be the following. Following orders from the dentist and doing what is best for the patient's welfare? Is it more important to follow orders from the dentist or more important to recommend appropriate treatment with evidence-based research? Step 2. Collect information. The patient's periodontal condition was not previously documented in their charts, which raises concerns about the continuity of care prior to oversight. The patient's health is at risk if untreated, as periodontal disease, especially with probing depths of 6 millimeters, can lead to further bone loss and even tooth loss. Failure to address the condition could result in long-term consequences for the patient's oral and systemic health. There is also a possibility of negligence on the part of the dentist, which could be classified as malpractice if the patient's care is deemed inadequate. Step 3. State the options. Option 1. Follow the dentist's recommendation and proceed with standard scaling, even though the patient's condition might warrant more advanced treatment. Option 2. Refuse of the treatment and refer the patient to a periodontist for specialized care, as the hygienist had suggested during the appointment. Option 3. Further discuss with the dentist and office manager to find a collaborative solution that prioritizes the patient's well-being while maintaining professional relations within the dental office. Option 4. Report the problem as malpractice to the Board of Dentistry if the dentist's response is deemed harmful to the patient's health, as this would ensure legal accountability and prevent further harm to the patient. Step 4. Apply ethical principles. Non-malevolence, do no harm. The hygienist's primary duty is to ensure that no harm is done to the patient. Proceeding with the dentist's recommendation could lead to further deterioration of the patient's oral health, thus violating this principle. Benevolence, promote good. Referring the patient to a periodontist would promote the patient's best interest and ensure that they receive the appropriate treatment for their condition. Failure to do so could prevent the patient from getting the necessary care and exacerbate their condition. Justice, fairness, and equal treatment. By recommending further treatment, the hygienist would ensure that the patient is treated fairly based on their specific oral health needs. Providing substandard care would violate the principle of fairness. Autonomy, the patient's right to choose. The patient has a right to make an informed decision about their care. By providing the patient with all the relevant information, including the risks associated with adequate treatment, the dental hygienist can support the patient's autonomy. Step 5. Making the decision. The option that best benefits the patient would be refusing treatment and recommending that the patient see the periodontist, as the hygienist did in this scenario. It would be important to have a conversation with the dentist and possibly include the office manager if a mediator is needed. When making a final decision about an ethical dilemma such as the one that was presented in this case study, it is important to remember that the well-being of the patient comes first. Minihan Anderson 2024 states that the seriousness of the cons must be weighed by the dental hygienist, remembering that as a professional, he or she is obligated to put the patient's interest first. Page 60. Although this option best benefits the patient, it is important to remember that the option removes most of the autonomy of the patient, as they do not have a say in the refusal of treatment. The patient will not have options to choose from besides being referred to a periodontist for further treatment. Although the patient does have the possibility of rescheduling with another hygienist at the office, the documentation of refusal might steer other hygienists away from wanting to complete the scaling on the patient. Step 6. Implementing the decision. The dental hygienist must explain the decision to the patient in clear and compassionate manner, emphasizing the risks of not addressing the periodontal issue. The patient should be informed about the importance of seeing a specialist and the potential consequences of leaving the condition untreated. Offering the patient resources and guidance on how to proceed with the periodontist referral would help maintain the trust and encourage compliance with the recommendation. Asking the practice manager for support through this process is important. Minhan Anderson, 2024, page 38 to 41. Conclusion. This case study highlights the ethical dilemma dental professionals can encounter when patient care conflicts with the dentist's instructions. The dental hygienist had to decide between following the dentist's recommendation or advocating for the patient's best interest. By suggesting a referral to a periodontist, the dental hygienist adhered to the principles of doing no harm, promoting good, and ensuring fairness. This case underscores the importance of standing by evidence-based care and maintaining professional integrity to ensure patients receive the proper treatments they deserve.